Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we're honored to be with our good friend, Dr. Scott Morris. He is a medical doctor, a pastor, and founder and CEO of Church Health, which is the nation's largest charitably funded, faith-based healthcare center. And he's also an author. We'll talk about his new book, Care, How People of Faith Can Respond to Our Broken Health System. And so, Dr. Morris, how are you doing, buddy?
I'm great, Jeremy. Thanks for having me on.
Absolutely. So we will definitely focus on the book, but let's start with a little bit of your history, because when you talk about being a medical doctor, a pastor, coming to Memphis, being the founder and CEO of Church Health, give us a little bit of your storyline, which will lead us to the book.
Well, I grew up in Atlanta, and growing up in Atlanta, I was always interested in the church, but even as a teenager, the thought of preaching 52 sermons a year sent shivers down my spine, still does. I have no idea how anybody could do that. But as a teenager, I read the Bible and saw that a third of the Bible has to do with healing the sick. It's literally on every page. But I would look around and just didn't see my church or really any church taking it very seriously. You know, all over the country, we had built large hospitals that have church names on them. They do good work, but they have almost nothing to do with worshiping congregations. So it seemed to me that there ought to be more to it than that. So I set out to find a way that in my own life, I could connect both medicine and ministry. And it led me to go to seminary. And in seminary, I came to realize there's a reason these hospitals have church names on them. We just forgot. And so I'm still trying to figure out what I would do in my own life. And then one day I was in the chaplain's office at the Yale Medical School, and I looked on his desk, and there was a little pamphlet that said how to start a church-based health clinic. And I go, that's it. That's what I want to do. And after going to school for a long time, I found my way to Memphis and started what is now Church Health in 1987.
And why did you choose Memphis?
Yeah, I'm not making this up. I literally read somewhere that Memphis was the poorest major city in America. And based on that, this is the place for me. So I came here literally not knowing a soul, just selling out of an empty cart, knocking on doors. To start something called the Church Health Center, going to have a cross in its logo, led by a Methodist minister. I went to the most obvious place for funding, a Jewish family foundation. And I tell that story just because it's reflective of who I think we are. Paul says we see through a glass darkly. What I think that means is that none of us have all the answers. We need each other. Diversity in all its forms is a good thing.
Before we dive deep into the book, talk about Church Health, because what you do is absolutely amazing. The model you've created is amazing as well. So give us some background on Church Health.
Yeah, so we've been doing this for 35 years. What we do is provide health care for the people who work to make our lives comfortable. They cook our food, take care of our children, wash our dishes, cut our grass, will one day dig our graves. Yet when they get sick, their options are very few. There are currently about 80,000 people in Memphis who depend on Church Health. So we do this with a team of physicians on our staff, plus we run a family medicine residency, but then we have 1,000 doctors who volunteer with us. That's not a made-up number. But we do this in partnership with the hospitals so that patients never get a bill. And our goal is to provide the same quality of care you'd expect your mother to receive. If we can't deliver on that, then we're not going to do it. But one of the things we've done over the last 35 years is connect with other communities around the country. And Nashville is a good example, but all over the country to try to spawn other clinics very similar to ours. In Nashville, Faith Family, Siloam, in Knoxville, Interfaith Health. These are all clinics that would tell you that they were modeled after our work in Memphis.
Give me a little bit of, you mentioned the unique model in terms of the volunteers, the specialization that you pull in as part of a family. I look at it too as a very holistic approach with dentistry, the oral health, just as much as obviously the health. You've got rehabilitation, a unique partnership with YMCA. So you've got cooking classes, a state-of-the-art kitchen. You've got some really special amenities and collaborations. Give us a little bit on that side.
Well, so we began in a little small house in Midtown Memphis. And then in 2017, we moved into as the anchor tenant of Crosstown Concourse. So we took a building that had been a Sears distribution center, but had been abandoned since 1992, but in square footage is larger than the Empire State Building. And, it's amazing what $300 million can do to an abandoned building. But Church Health's the anchor tenant here, and we do have dental care, eye care, counseling. What we focus on, though, is really the idea of what it takes to be healthy. So being healthy is actually not the absence of disease. We think it's ultimately about three things: having more joy in your life, having more love in your life, and being driven closer to things greater than we are. Now, we would call that God. But for all of us, there are things greater than we are. But if that's what it takes to be healthy, more joy, more love, being driven closer to God, it doesn't have a lot to do with the doctor. So all of our programming connects to this idea. And so, yes, the medical care is part of it, but it's only part. But nutrition, movement, emotions, family and friends, work, and we define your faith life as every bit as important as what the doctor might do if you want to be healthy.
And that's that full circle. And I think that leads us into the book. And so once again, the book is Care: How People of Faith Can Respond to Our Broken Health System. This is definitely not your first book. And so you are an author of other books as well. But what led you to write this book?
Yeah, so I really think this is the most important book I have written. And it's not just about the work in Memphis. It is ultimately about, to start with, why our healthcare system is broken. And it absolutely is broken. But then what I believe and what Church Health is operating under is the idea that the faith community actually has a lot to offer to the healthcare system and across America. And so while I do tell stories about our experience in Memphis, I also tell stories about clinics all over the country, from Texas to New York to California, who are doing this work. And what they've done is engage the faith community. I mean, none of these clinics are federally funded. The government cannot do the work of people of faith, and neither should we ask it to. So they're all privately funded with the resources of faith communities that support this work. But if you start digging down into it, these clinics actually care for millions of people across our country, and yet people don't know it's happening. So I thought it was time to tell the story. And I think the story is both inspiring, but it's also important, and it's a story that needs to be told.
So we definitely want everyone to buy the book, which means we won't go too deep into these, but give me one example of how the healthcare system is broken. Let's start there.
We have focused so much on technology in America that we think I can live my life any way I want to, and it doesn't matter. Because when I'm broken, the doctor could use that technology to fix me. But the reality is the technology is not that good, and the doctor is not that smart. So we all need to find ways to engage in living a healthy life that goes beyond just taking pills. I talk a lot about why the cost of drugs are so expensive, and it's really just a shame when you understand how certain pharmaceutical companies have just manipulated the system to drive the cost of pharmaceutical companies' drugs in America. An example of this is a drug called colchicine. So colchicine was actually used by the Egyptians. There are hieroglyphics that show it being used for the treatment of gout. Now, pray you never have gout. It's a terribly painful thing. And yet this drug colchicine can relieve people's pain within an hour or two. Benjamin Franklin used to use colchicine. But then about 15 years ago, a pharmaceutical company realized that there had never been any double-blind controlled studies to demonstrate the efficacy of this drug that has been around since the Egyptians. Now, when I first started practicing medicine, colchicine cost about between 2 and 5 cents a pill, a nickel a pill. After this drug company did their research, they started charging, with the approval of the FDA, $20 a pill. It completely priced it out of the ability for poor people to receive care. Or a similar story is the whole terrible situation we are in right now with insulin. The people who discovered insulin and how it was useful to treat diabetes, life-saving, they never wanted to patent insulin. They gave it away. And during their lifetime, the agreement was that no one would ever pay more than $1 a vial. I mean, these days, for some insulins, it's more than $300 a vial. And we're in a place right now where it's truly beyond the ability for poor people to receive insulin. That's just an example of how the system is broken. And the book tells a lot more about the brokenness of this, but it then also is a book about hope that talks about how clinics all over the country are rising above these problems.
Well, and that's exactly where I was going to go next, is let's go to the inspiration and the hope. And so give me kind of one story that illustrates, and obviously Church Health is a shining example of this, but as you mentioned, there's many other stories in the book. So what's one other one that does exemplify and show the hope and the way that we have an opportunity to do it right?
Well, so most people have never heard of Cactus, Texas. I truthfully had not heard of it either, but Cactus is a little small town in the Panhandle of Texas that really focuses on livestock and beef production. There's about 20,000 people who live there. The lion's share of them are refugees in one fashion or the other. But the Church of the Nazarene developed a center there, a community center, and then a young physician from Ohio was actually a missionary in Papua New Guinea, but decided she actually wanted to come back to America and found her way to Cactus, and under the umbrella of the Church of the Nazarene, started a clinic that is remarkable in terms of their ability to do the very same work that Church Health is doing, with specific support from the Church of the Nazarene, but taking care of people who, your dinner tonight may have been touched by these people in Cactus, and it's a community you've never heard of, but when they get sick, this little clinic is what's giving people hope for the future for their lives.
I think that's something we've learned through the pandemic and obviously all the supply chain challenges. And when you talk about everything going on in the world today, we're all interconnected. And to your point, something that happens in Cactus, Texas could very easily impact what sits on the dinner table, so to speak, here in the Mid-South. And so everything is interconnected. How can we as the community get more involved? Because obviously through Church Health here in the Mid-South, but outside of this, when you talk about the book and lessons learned and what you want the public to do to activate, what's one or two things we can do to get involved?
Yeah, so there are so many ways that people of faith can get involved in issues around health without actually having to be a doctor or a nurse or a dentist. Let's just start with the issue of food. We are what we eat, but the Bible is very clear that issues around food and communal eating is vital to our faith. There are very few things that happen in the Bible where a person's just eating alone. We've tried to make our food very complicated, but it actually isn't. If you want to know how to eat healthy, eat the way Jesus ate. Jesus ate food that was always locally grown. He ate food that was grown close to the ground. He never ate alone. You can't imagine Jesus going through a fast food restaurant and ordering and eating in his lap on the way to work. Jesus would have never done that, and neither should you. And yet, despite all that, the least healthy meal you could eat every week is at a church. Our churches have blessed the sin of gluttony for the sake of fellowship. In the midst of the obesity epidemic in America, clergy are 20% heavier than the rest of the population. So let's just start in our faith communities right there. Let's find a way that we can have healthy communal meals, and realize that our language, particularly from a Christian perspective, is very much about our communion. We eat at the table of the Lord, and yet we are doing things that the Lord himself would never have done.
So wrap up with where we can get the book, because it is available right now on Amazon. And so talk about where we can get the book.
Yeah, you can get it wherever you buy books. In Memphis at Novel or Books Bookstore. You can certainly get it off of Amazon. And anywhere you would normally go buy a new book, it should be available. There's an audio book coming out here relatively soon. It's not there yet, but it is available. And it's also, I think it's a great book for a discussion. It's sort of set up to where there are discussion questions. So in a Sunday school class, or whatever type of endeavor you have that brings people together, because ultimately, this issue of health is very much at the core of who we are as people of faith. And I'm a United Methodist minister, but these ideas work across the board. And it's whether you're Jewish, Christian, Muslim, we all have the same obligation to care for our bodies as well as our spirit, and to care for the poor when they're sick. Yet we're not doing it. And in some ways, I think this is ultimately about evangelism. We will not grow our churches through more bad Christian rock music. We actually can grow our churches by doing what we're called to do. Caring for ourselves and finding a way that we care for our neighbors. And even if you have times of doubt in your own life, actually doing this work can actually bring us together in a powerful way that allows us to realize that our faith has meaning. One of the things that COVID did is created lots of doubt about the future of our churches and our faith communities. And yet, COVID very much clearly showed to us that our bodies are part of who we are. And if we don't care for it, then things will fall apart. And it's time for us to get beyond spending all this money on buildings and come back together to say, well, what is the real essence of ministry? What does it look like to care for each other? And again, I'm speaking from my own Christian experience, but I know that Jews and Muslim and Hindus have the same experience, and we are called to do the same work wherever we are.
Where can we go to carry this conversation forward? So connecting in with Church Health and you and your amazing team, where do we go for more information there?
Yeah, so really, there is not a city in America that doesn't have a clinic similar to the work of Church Health. Here in Memphis, certainly you come and be engaged with our work at Crosstown Concourse. In Nashville at Siloam, or Interfaith Dental is another clinic modeled after us. But all across America, there are clinics like this that can use people's help to be involved with this work. And just realize that the people who are being uncared for in America are very much people who touch our lives. They're the person who's going to wash your dishes tonight. They're going to do that work that nobody else is willing to do. But there's really no community in America that people like this are not falling through the cracks for. And clinics like ours exist in every community. So go find what that clinic is wherever you live. And then go want to volunteer. Go find a way to financially support them. In Memphis, Church Health has to raise $25 million a year. I wish it was 25,000. That's literally every year. So, we need your support. And, if we're going into a recession, that makes it that much harder. But, no gift is too small, and nobody's going to turn you away as a volunteer. We all have a skill set that can make a difference.
Absolutely. Very well said. The book, once again, is Care: How People of Faith Can Respond to Our Broken Health System by Dr. Scott Morris. The book is out now, so make sure and grab your copy. Dr. Morris, thank you for all you and your amazing team do. Congratulations on the book, and best of luck for the future ahead with it. Appreciate you and your team. Thank you for coming on the show.
It was my honor. And that Church Health's website is churchhealth.org. If you want to learn more about our work, that's probably the easiest place to go.